University of Iowa Hospitals and Clinics is one of the most highly regarded academic institutions in the United States and is the only tertiary referral center in the state of Iowa. Nationally ranked in over 10 specialties by U.S. News & World Report, and having achieved nurse magnet status many times in a row are high recognitions for the hospital. As we all know, healthcare is challenged today to produce increasingly good results with decreasing resources on a national level. Big data and predictive analytics is transforming outcomes at virtually every point in patient care. We have over 1,400 physicians and over 7,000 employees, be it at the administrative level of healthcare institutions or at the bedside level. Our group is trying to personalize healthcare through the use of predictive analytics, allowing us to achieve effective, available, timely, and appropriate health care for every patient who comes through the door. One example of how we're using predictive analytics in Statistica is in reducing surgical site infections for patients who are undergoing surgery. Surgical site infections are the most common and most costly type of hospital-acquired infections that we have. We're able to take information from the electronic medical record and other enterprise sources, including real-time data from the operating room, and turn that into a knowledge of whether patients are going to get a surgical site infection. This allows us to change the type of care that we're delivering in the operating room before the patient even leaves. In fact, using Statistica and other methods, we've been able to reduce surgical site infections by about 58%. That's a revolutionary concept to be able to reduce surgical site infections by that degree. Before we had Statistica, we were able to create models, but we were never really able to deploy these models throughout the enterprise. And with the addition of Statistica, we now have an efficient way of providing that modeling data out to the frontline providers.
This has allowed us to deliver predictive analytics in a challenging environment like this hospital to improve healthcare and reduce costs. We have different data sources, we have complicated workflows. It helps you to actually deploy the data model. You can store the data model in a server and then reuse it.
The impact that we've been able to make in patients' lives has been really incredible by having the precision in the decision-making that we use around surgery that really complements the type of precision that we use in an operation itself. Statistica has been a fantastic partner in allowing us to achieve better outcomes for our patients. I enjoy seeing patients back in the office who've had a fantastic outcome from surgery, and big data analytics has allowed me to improve that experience for myself and for my patients.